Public Health Institute of Western Massachusetts, and we are one of the Community Health Equity Survey regional data and action assistance providers. And I am going to turn it over to my colleague here, McCain Scharf at Mass Department of Public Health.
Hi, good afternoon, everyone. Thanks for joining us. As Kathleen said, my name is McCain Scharf, and I am an epidemiologist with the Community Health Equity Initiative at DPH. We're happy to have you all here. We're just going to jump right in. We will have breakouts after some presentations from partners. And we have some ASL interpretation here today. If you would just put a quick note in the chat or chat Isabella Fuentes directly and let us know if you would like ASL interpretation in the breakout. That would be great. Okay. So as we get started, if everyone would take a minute to put your name, the organization you work with, and your pronouns in the chat so we know who's here with us today. We have a lot of folks. And Kathleen already introduced herself, but I'll also just mention that Isabella Fuentes from our DPH team is here, along with Kara Washington. And we have Rebecca Hunt, also from the Public Health Institute of Western Mass. And did Tanaya hop off?
I'm here.
No, Tanaya's here, sorry. And Tanaya Tonpei, who is from the MAPC, who is our other data and action support provider. So we'll jump right into our slides, just a very brief introduction to the Community Health Equity Initiative, a little bit about our survey, and the data and action framework. And then we have three partners here today who will share their stories about using the data from the CHES for action. And then, as I said, we'll have breakouts. We can get started with our CHES overview. So we are the Community Health Equity Initiative, and our goal is to promote the health of Massachusetts residents and reduce health inequities through a health equity data and response system. And this health system is built on three foundational pillars. Our health equity data system, which I'll talk a little bit more about, a commitment to community engagement practice throughout our process, and data and action, which is really what we are focused on right now, that we have our survey data from last year and wanting to make sure that folks are able to access the data they need and use it to inform and support action that they're doing in their communities. Next slide. So we have specific communities that we focus on to reach and to report out on. And we are centering communities that are often underrepresented in data systems and most impacted by health inequities. They are listed here and include older adults, parents and caregivers of children and youth with special health care needs, parents under 25, people identifying as LGBTQ+, people of color, people whose primary language is not English, people with disabilities, people with immigration experience, pregnant people and parents of young children, rural residents, veterans, and youth and young adults aged 14 to 24. And here are our survey topics that were included in our 2023 survey. They range everywhere from demographic information such as age, gender identity, race, ethnicity, sexual orientation, access to healthcare, basic needs, education, information sources, COVID-19 experiences, and neighborhood. And as I mentioned, we're very much focused on data and action. This is the data and action framework developed by the Public Health Institute of Western Mass. And it recognizes that this is an iterative process and a fluid process. So it's not depicted as a linear process, but often we will start by defining what our question is. We will decide what data to analyze and interpret, and then look at that data and prioritize what feels most important, act accordingly, and then evaluate to see whether our actions had the desired effect. And all of this work is centered in a community engagement and collaboration practice that centers equity, voice, and power of our communities we work with and residents of Massachusetts. And the goal is to drive positive change and improve health for all residents.
Thanks, Jane. So now we're going to have the opportunity to hear from some of our community partners about how they've used the CHES data for action. We've had the good fortune to be able to work with a number of people from across the state to think about how they can use the Community Health Equity Survey to support their actions. So today you'll have the opportunity to hear from a few of them. So we're going to start, and I will stop sharing the screen, and we're going to hear from Jackie Doherty of ARC of Massachusetts, and then we'll hear from Lisa Rangeli and Rachel Pry. So, Jackie, welcome.
Thank you so much for this opportunity. And I apologize, I have to leave early today. I was in an accident and I'm undergoing physical therapy for whiplash. So I got to take those appointments when they're available. So I am the Director of Education Outreach for the ARC of Massachusetts. And our focus is on people with disabilities, primarily adults with disabilities, and primarily adults with intellectual and developmental disabilities, which the acronym is IDD, and people on the spectrum for autism. Our work is focused in two areas, advocacy and trying to advocate with the state legislature and on a national level for resources and regulations and laws that support people with disabilities, and especially those categories that we focus on that I mentioned, IDD and autism. The other part of our work is around educating and informing families who have loved ones with disabilities on what their rights are, processes, the different resources out there that they can use, that they can benefit from in helping them to support the lives of their loved ones. So through that lens, we were looking for information that will impact the work we do around legislation. What areas should we be focused on advocating for, and what areas of information or what resources are most important to our families and individuals that we serve. So when we got the information right out of the gate, we're looking at, okay, I think there was something like 18,000 respondents to the survey. We wanted to break that down. How many of those people self-identified as having disabilities, right? So with that number, and I'm talking off the top of my head, if I get this wrong, I know Tanea will help me, brought it down to 4,000 people that had self-identified a disability. So it was me and a colleague from my team worked with Tanaya. We went to a couple of the workshops and really looking at what are some other areas we want to look at. So we had separate out to some areas that were important to us. We want to look at the numbers statewide. We want to look at from a geographic basis, from economic basis, from demographics like race, age. These were all factors that we wanted to look at. And then today, so that was just working with my colleague and Tanea. Today, when we had gotten some information charts and breaking that down into chunks, as we called it, and then we asked her to attend our directors level meeting so we could really get the leadership in the room to look at what we had already broken down and what the information was telling us and what were other pieces that they felt would be important. And so that I thought was very helpful. Thank you again for your time this morning. We were able to identify, okay, so it's not enough to know that they self-identify as having a disability. Can we break it down to those who have IDD, intellectual developmental disabilities, those who have autism, and even if you have autism, those who have profound autism versus those who have just developmental delay autism, because the needs are very different for those groups. And also when we looked at the mental health data, can we break that down further? Because a lot of the families that we work with, one of the biggest struggles is behaviors, right? If you have a loved one who is profoundly autistic, they might demonstrate behaviors that are very difficult to support in a day program or any kind of employment, different circumstances. So we are still in that process of refining what pieces of this information that we can look at from that lens of these very specific populations that we're trying to serve, and then be able to extrapolate from that. How do we use that to inform the advocacy work we do with the state legislature? Because much of the work we do when we're talking to our state legislators is around stories, as we call them. Like you have this family struggling with this issue, because of course that brings it home to people when it's not just a statistic or a number. We've got 32,000 adults with intellectual disabilities being served by DDS today or whatever, but it makes it personal when you can tell a story about a family living in Wakefield or living in Brighton or whatever the struggles that they're having. So to use data to back up our stories, we think will be a very powerful tool for us going forward. And so I think it's really kind of that's a snapshot of where we are in progress. I think the data has been very interesting for us to get a look at, and we've been very excited to be included in the project. Our next steps with our leadership team is they want to really look at the questions more closely, because it's primarily just been me and my colleague who really had that front end look at the work that was done in collecting this data. So we're going to look at the questions to see if there's other areas we want to do a deeper dive, and also to be able to get you all thinking about what are some of the things for future surveys that would be worth collecting in that kind of granular way, that would be useful for an organization like ours that has a very specific community that we're trying to serve. So thank you so much. I hope that was helpful.
Thank you so much, Jackie, for sharing how your organization is using this data to help to understand where, with the folks that you're serving, where there hasn't been data in the past, and to support your stories in legislative advocacy. So, okay, so now we're going to turn to another story of how CHES data is being used. And so Lisa Rangeli from the Public Health Institute of Western Mass is going to now share about how the data is being used for community health needs assessments. Lisa, I'll turn it over to you.
Hi, everyone. Apologies, I have a little bit of a cold still, so I might sound a little nasally. So yes, my name is Lisa Rangeli. I'm Director of Assessment and Capacity Building at the Public Health Institute. So I'm here wearing a different hat from my colleagues Kathleen and Rebecca today. I'm a recipient or a beneficiary of the TA. And so every 3 years we work in partnership with a coalition of hospitals in Western Massachusetts and Health New England to produce community health needs assessments, or CHENAs, for 8 different health organizations in the region. So it's a big undertaking. It's a very community engaged process. We have a regional advisory committee or council that we partner with. And in 2022, the COVID community impact survey data was, very, very helpful in understanding needs. And we now are excited to be able to use the CHES data as well. And actually, there's coincidentally, beneficially, an overlap with a number of the communities that McCain mentioned being an important priority. These had also been identified by the Coalition of Hospitals as important communities of interest. So specifically, older adults, immigrants and refugees, parents and their young children, and then also birthing people, people experiencing maternal health disparities. And then another key regional focus area is substance use and mental health. So, so one thing we're trying to do this time around is to have more of a policy lens to the CHENA process. So federal regulations require that these reports really speak broadly to the health related needs, including social determinants of health, health access, chronic conditions, that we paint a picture of the health needs in the region. And obviously the hospitals will use that information for their own health equity plans and strategic implementation plans. We have community health improvement planning organizations or CHIP groups that use this data, and many other community organizations use this data. But we want to go a step further and really bring more of that policy lens. And so the way that looks different this time around is that early on, we looked to see where there were like policies in play, so to speak, with some of these big issues. So, for example, a maternal health law has just been passed to try to address maternal health and birth equity issues and inequities. And so we are complementing the quantitative data that we're getting from CHES and census and other data with qualitative data collection, where we are going to be talking to professionals in the field who are working with these different populations and on these different issues. And we're going to be very specifically asking them either, depending on where the policy landscape is for that issue, what is it that is going well with policy implementation? If there's a new law being implemented, how is that affecting these specific populations in our region in Western Mass? What's working well? What can be done differently? If there aren't policies in play, what policies need to be improved or adjusted? So we're in more close contact with our own in-house policy director, Andrea Freeman. We're more in close contact with legislators to understand what do they want to know about the policy landscape related to these health equity issues. And of course, our regional advisory council and the hospitals. So we're spending a lot more time at the front end trying to understand the policy landscape, and then asking more direct questions related to public policy. And then in these community health needs assessment reports or in complementary documents, we will lift up what we know about how these policies are or are not benefiting and helping to reduce inequities and what still needs to be done. So I hope that covered everything, but Kathleen and Rebecca, feel free to pipe in if there's things I didn't speak to that you want me to address.
Thanks. That's great, Lisa. I think it really speaks to how the data is being used in a CHENA, Community Health Needs Assessment process, but also how CHES data is being used alongside other quantitative data like census data and other data sources, hospitalization ER data, and qualitative data to help support policy advocacy change. So thank you for sharing. I know that Jackie is going to need to be leaving shortly, and Lisa may as well. We have one other person to hear from, and she was not able to be here. So we have a video of Rachel Pride sharing her story. If people have questions for Jackie, she'll be here for maybe a couple more minutes. And then also Lisa, you can feel free to drop them in the chat. And so I am going to go ahead and share screen, and we will hear from Rachel.
My name is Rachel Pride. I work for Essentia Care
Apologies.
Alliance. We are based mostly out of Worcester, but also West Springfield. My department is the nutritional life skills education. My exact position is the SNAP Ed Garden Program Coordinator. We try to increase healthy outcomes through educational interventions. And we definitely focus on SNAP eligible communities. I'm the garden program coordinator for Hampshire, Hampton, and Worcester counties. So I try to facilitate different garden programs and making connections with the local farms and schools and day programs. And honestly, the sky's the limit sometimes. So after talking to Rebecca and going over some of this data, there was a couple of things that stood out to me that ended up being really helpful for my team. And one of them was noticing that out of all the people who had reported that they were struggling to have enough money for basic needs, specifically enough money for food, as we are a SNAP DTA, we focus a lot on food access. And so out of all those people, almost 70% said that they hadn't applied or received any food benefits. Over 90% said they didn't have any cash benefits. And surprisingly, almost 95% of women who said they couldn't have enough money for baby food and formula, 95% of them hadn't applied for WIC. So that created a lot of discussion in my team. It's like, why is there a separation between people who are reporting that they need more money and access to food and not applying for SNAPs benefits? We had a lot of discussions and have changed a few of our approaches. And some of the reasons we thought could be there's a stigma around it, or maybe an embarrassment, or like I feel bad if I'm getting a handout type of reaction. And the other one is that some people just don't know that these benefits exist or how to get them. And sometimes when you call those 1-800 numbers, this is something that the SNAP coalition groups are working on. They're not very user friendly. So we've been changing some of our approaches. When we are doing presentations and classes, we are going to be doing a YouTube channel. We recently got on a local TV access show, but we are going to be providing these in a lot of different languages, and we're going to be having some ASL interpreters come in so we can also make it accessible to as many people as possible. And even some of the language when we're talking to people at farmers markets about, hey, you can use some of your SNAP benefits right here at the farmers market. We try to make it a lot more personal. We don't want anyone to feel embarrassed because they're like, oh, I'm going to use my SNAP card. And it is a combination of talking to the public and talking to the farmers and helping them like understand that some people, they may need that food, but they might feel embarrassed, especially if there's a line and they're like, oh, I've got to use my SNAP benefits. Sometimes people feel badly about that. So we're trying to bridge some of those gaps, make it more accessible, reduce some of the stigma, even making it a little bit more personal. When I was in college as a single mom, I sure was on SNAP benefits, and even sometimes just making it personal and tell my story about how it helped me feed my kids and take care of myself. So I got to the point where I could finish my education and provide a better life. it makes it a lot more approachable and real, and people don't have to feel like bad about that. Um, yeah, I don't know. Do you have any questions for me?
Oh my gosh. No, this was amazing. I would love to hear a little bit more about, I know we had talked about this before the recording started, but a little bit more about some of the connections that you made at the cohort meeting the last time that you talked about some of your CHES adjacent work.
Yeah, I feel bad. I cannot remember her name, but there was a woman who was hearing impaired who spoke with American Sign Language and talked about how sometimes we do a lot of different languages, but some of the information isn't as accessible for some of those communities.
Mhm.
And really, when we're doing the TV shows, we talked about the closed captioning on the bottom, but sometimes you don't get the full message when you're trying to read what's on the bottom instead of like watching the content of what's happening on the show. So that's why we've been doing some work with the language bank on getting some interpreters to come in to do some of our classes in ASL, so they can have more access. And I really appreciated that connection because like we get a lot, we pride ourselves in a lot of the translated materials and try to get as many languages represented as possible. And I will be honest, it was one aspect of language barrier that we overlooked and didn't think of. So when I brought it to the team meeting, everyone kind of had light bulbs going off like, wow, yeah, why didn't we think of that? And, you know, there's probably a lot of organizations that do overlook those communities. So that was a really great connection.
So I'm going to pause it there. And so really appreciate Rachel sharing in her video about how she and her team have used the data for action and really thought about the services they're providing. And then also Rachel was referring to a recent meeting that we had for the Community Health Equity Survey. And by talking to others, it helped them to think about being able to make sure that the information that they provide is accessible. So I'm looking at the chat and seeing if we have any questions at all. I believe Jackie had to leave. And if we have any questions for Lisa, and it doesn't look like it. Okay. So thank you, Lisa, for joining us today. And now let's see. We are going to, hold on, move into the breakout. Oh, sorry. I thought I was sharing screen. We are going to move into the breakout room discussions. So what we are going to be having people speak about in the breakout rooms. So these are the prompts for discussion. And so what resonates with you from the story shared and how data is or was used for action. So we heard some different examples there, from thinking about how it could be used for legislative advocacy, thinking about data supporting stories, thinking about for having it combined with other data and qualitative data to support thinking about policy change, and then also very specifically programmatic action. And I'm sure there's other ways that people in your groups will think about how it could be used. And then in addition, what one next step can you take to use the Community Health Equity Survey data for action? And as you all are thinking about that, thinking about what supports, if any, would be helping in using the data for action. We'll be having additional webinars, and we provide regional data and action support. And we want to make sure that we're providing as much support as is feasible to support different organizations using this data for action. So I believe Rebecca dropped the prompts in the chat. I am going to stop sharing. And we are going to move into breakout rooms. And we'll have about 10 minutes in those rooms. And if someone could please, in each of the breakout rooms, be designated or volunteer to take notes, high-level notes about what's discussed, and we'll have a quick share out after the breakout rooms about what people discussed. So as we have people rejoining us, was wondering if we could do this popcorn style, if a few folks might be willing to share from their breakout rooms. What were some of the key things that stood out for them or that the group had discussed, either what resonated, a step for action, and or types of support? Great. So I see McCain is adding a link to the data dashboard. So on the DPH website for the Community Health Equity Initiative and the survey, there is a data dashboard. We'll have also describe some of the other resources there shortly. So do we have a volunteer of someone who'd be willing to share?
Why not? I'll go if you don't. I guess I can go for our group. Where's Helen? I've got Jenna. I see some of my teammates here. So we, a lot of us, we had said, this was a little while ago, and I had remembered the first survey when that went out, and it was quite some time ago, so I sort of had to refresh my memory. But I think what we discussed, we had Jenna in the group. She's an intern, and she had some really good information to share regarding sort of her experience working with the data. But we had talked about that, we think it's amazing, robust. There's a lot of really important data there. But like I spoke of sort of from my perspective, from a tribal community, how often the data is skewed and it's not always accurate. And sometimes we talked about, sometimes the people that you really want to be taking the survey are not the ones. So for instance, tribal communities, there's sort of a mistrust of the government. So our people are more hesitant to take these surveys and such. And every community sort of has its own unique, situation, I'm sure, in that sense. So we just talked about, how amazing we think the data is and how, one of our group members talked about how they could use the data for, to write grants and for programming and such, which we all agreed on. But we also said that, we wonder sometimes how accurate the data is, especially, for communities we know that are sometimes underreported. And I know Native communities also, some of our people often will check more than one box. So is the data, how do we separate when they say I'm both or multiple in many cases? So we know that, so that was really what we talked about, just sort of how the data is interpreted and whether or not, how actually accurate it might be. And our job, we talked about what could we do would be to analyze it and see, does it look right? From a tribal perspective, I need to go look at that and say, hey, yeah, that looks close or it's way off, so our job would be to kind of do that. So yeah, I think that's it. And if I missed anything, please, Helen or anyone else, Jenna or anyone else, speak up. Thank you.
Thank you so much for sharing, and really great points that your group was making. We're going to be having office hours. That's one of the things that I was going to share, that we were going to share coming up at the end of this month. But that's also part of the support we can provide as regional data and action support providers in thinking through what are some of the limitations of the data depending on what groups or geographies you're trying to look at. You also mentioned the interpretation of it, and one of the things that we didn't show today, but we've have as a resource is collaborative data analysis and meaning making. So engaging different groups that you're working with and trying to
Kathleen,
understand
could
the
you
data.
speak up a little bit? I'm having a hard time hearing you. This is the interpreter.
Sure. So what I was saying is that one of the resources that we didn't share today, but we have available is for collaborative data analysis and meaning making, so that some had shared today in their examples about having people look at the data and better understand what does it mean. And so we can share more of that as well. So we actually are pretty close to the end of time. I can say also, I think from the group discussion in my group that people were really appreciating thinking about from a standpoint of programs and nutrition, about hearing about the Accentria and racial pride story, about the data and thinking about how that informed programming and the different voices involved in that. And so it sounds like there's been a lot of rich discussion today in the breakout rooms. I want to share screen here. And so you can learn more. So it was dropped in the chat, I believe, the website for the Community Health Equity Initiative survey. And you can learn more about the survey, access the data tables for the Community Health Equity Survey, and then also request customized data and one-on-one assistance in using data to support your work from us or MAPC. So please check it out. There's a lot of great information there. And then upcoming is that we're going to be having office hours. So on January 21st, and I believe Isabella will be sending that information out as well. And it was in the newsletter, I believe, as well, at 3 p.m. And then also monthly webinars through June on different topics related to using the Community Health Equity Survey. So I'd like to invite others from my colleagues at DPH. So if there's things that you wanted to speak to or share, or Rebecca or Tanaya, other regional data assistance providers, if there's anything you'd like to share as we wrap this up for today.
Just want to thank everyone for coming today, especially for those who shared their stories and in the breakouts about how they've been using the data. Want to really encourage folks to use the resources that we've talked about here. So the one-on-one support available from the RDA providers is just really wonderful. You don't have to know exactly what data you want. You can have that conversation with them, explain what you're trying to do, and they can help you think through what data would be most helpful. And then encouraging folks to explore our data dashboard if you haven't already. You can break it down in many ways, including by county, rural cluster, or by identities for each of our communities of focus. So please explore our website. There's a lot there. We have a mental health report that's been published that you can look at, and more reports will be forthcoming. So thank you again for joining us, for being part of the Community Health Equity Initiative, and we hope that you'll all use our data for action.
Thank you, everyone.
And like Kathleen mentioned, everyone who has attended today will be getting a link from me for the office hours, where you can come and talk about kind of your specific community of focus, the specific data you're interested in, with the data and action support providers, as well as I put the link in the chat, but you can fill out the form to talk one-on-one with a data and action support provider if that's what you would prefer. So many ways to engage with these resources, either alone or in combination with other folks at the office hours, and more workshops coming up. There'll be one next month as well. So just on different topics as well. So really, really appreciate your engagement and participation. And we just hope that you can use this data to support all of the fantastic work that you're doing. Thank you so much for attending, and look out for some more inbox. Look out in your inbox for some more emails from me shortly. Have a great day, everyone.